Terry, it's good to see you again. I don't know if you remember me, but my name is
Hi.
Emma. I'm going to be the nurse working with you today, and I just wanted to talk to you a little bit today, just about some things that are going on in your life. One of my initial questions today is I wanted to talk to you about some of your habits that you have for coping with your depression. I know last time we talked, you mentioned you're a smoker. Are you still smoking?
Yes, I do.
You do?
Yes.
And how many packs a day do you smoke?
I smoke about 2 packs a day since age 14.
Okay.
14 years old.
And then, do you mind if we elaborate that on a little more?
Yeah, see, I smoke Camel cigarettes without any filter, and I have a chronic cough, shortness of breath, and like frequent sinus infections now.
Okay.
So,
I'd really like to spend some time talking about your smoking today, if you don't mind.
Oh, yeah, that's fine.
Okay. So one of the things that we like to talk about is figuring out what types of negative impacts or even just impacts at all that your habits can have on your daily living. So you mentioned you have a chronic cough and you've recently been diagnosed with COPD, right?
Yes.
Okay. So do you feel like your smoking might have an impact on your COPD?
Yeah, I think so.
It does?
Yes.
And you mentioned you suffer from a chronic cough. Are there any other problems that you have that are associated with your COPD?
No, not that I can think of, no.
Okay. Well, do you mind if I give you a little bit of advice just from my perspective as a nurse working with patients?
Yeah, that's fine.
From my experience, it's really beneficial even with a diagnosis of COPD if you can quit smoking. I know you've been smoking for about 10 years, and that while that does have an impact on your health, quitting now can make the rest of your life significantly more of a higher quality, and that can improve your COPD. You wouldn't have as many problems with that. So do you mind if we maybe discuss ways that we can consider you quitting smoking?
Yes, I can.
Okay. And so first of all, let's just kind of get a feel for how you feel about quitting. One of the tools we can use for that is what we call a readiness ruler. So we can rate it on a scale from 0 to 10, 0 being you're not even remotely ready to think about quitting, you want nothing to do with it, to 10 being, yeah, sure, I'd like to quit right now. So what would you rate your feelings for being ready to quit on that ruler?
Say a 3.
A 3, okay. And why do you think it's a 3 and not a 1 or a 2?
I'm just not ready to stop smoking because that's how I cope with my depression. So I don't know. I just don't think there's anything else maybe that can help. I don't know.
Okay. Okay. So we've established that your COPD is linked with your smoking. So let's talk about maybe some other downsides to smoking. One really good way to think about your readiness for quitting or making a change in your smoking habits is to make a list of pros and cons. So I gave you a couple of cons, your COPD and your cough. It can negatively impact your health. But I would love to hear what you have to say about that, if you have any pros or cons to your smoking habit.
Some pros would be that it calms me, and my family will be happy, and it's a role model for my niece, and yeah, that's really it.
So some of the things you really like to focus on is your niece. How old is your niece?
She is 10 years old.
She's 10? Okay. That's a fun age.
Yeah.
And you're really concerned about your family's happiness and how well you interact with your family.
Yes.
Do you find that your smoking impacts your relationship with your family at all?
No. Well, it impacts it to me in a positive way because I feel like whenever I'm smoking because of my depression that my family doesn't see that I am feeling depressed at that moment.
Okay, so a good thing about your smoking is that, what I'm hearing from you is that it calms you down, you can cope better with your depression, and this allows you to interact better with your family. But you also mentioned you wanted to be a positive role model for your niece. So you mind telling me a little bit more about that?
Yeah, well, the thing about smoking, I do realize that it does help me, but then when I think about my niece and how young she is and she sees that I smoke, then it might not be as positive in that aspect for my niece. So, I mean, sometimes I do think about other ways that I could possibly deal with my depression, but I just don't know what other ways there might be to do.
Okay. So, first, let's finish talking about maybe some of the health impacts of smoking. So, you know about the COPD and the cough. Do you know? Tell me any other maybe negative health impacts that you can think of that have to do with smoking. I don't know. Do you know any?
Well, it's not as far as health, but I know that like my clothes smell real bad whenever I smoke and stuff like that. So people kind of, notice that it smells and kind of impacts me that way too, and it doesn't help with my depression when people look at me weird or anything like that.
So some other effects from smoking are like you have asthma, problems breathing. You can have, if you plan on getting pregnant or having children in the future, you're 24, maybe not quite ready for that yet, but down the road, there can be some serious complications with pregnancy or having children if you're still smoking. It can also cause heart problems. There's been links between smoking for a long period of time and heart attacks or stroke. There's also a really big link between smoking and cancer. And I know a couple of times ago we talked about, your dad passing away from lung cancer. I know that's a huge contributor to your depression, and I think it's important for you to realize that your smoking habit could lead to this same situation for you in the future, which is kind of scary to think about. So now that you know maybe some of the downsides to smoking, would you like to hear about some other options that could help you cope with some of your depression?
Yes, I would.
Yeah, okay. So one of the really good options that you have is maybe some behavioral therapy. You feel like your smoking is the only way that you can deal with your depression. But this is what we in the healthcare profession call a distorted thinking. And there are other options for coping with depression. Coming to see the nurses in this perspective is actually one of the ways that you can deal with that depression. And some of your anxiety with quitting, or just talking to professionals about your options and what you can do to cope with your depression. Seeing a doctor, seeing a psychologist, a support group. You're in a support group for your depression. A support group for smoking cessation would be a really good idea too. So, some options. What do you think would be helpful for you to be successful in quitting smoking? What are some options that you think would work for you in coping with your depression instead of smoking?
Maybe something that deals with my family, thing that I do, focus on my family, something that we can do together that they can help me with, might help me out.
Your family is an excellent resource. So we're about out of time for today, but just at the end, I'd like to go through and reassess the readiness rule we used at the beginning. So now that we've had a chance to talk about this a little bit, how do you feel, again, on the scale from 0 to 10 about quitting at this point?
I feel about like an 8.
An 8? Okay, so just the last thing, I want us to work at setting a quit date.
Okay.
And really the next 2 weeks. So when we're checking out, we can have you set a date, and then I also want to set up another appointment with you in about 2 weeks or so, because there's some side effects you can have with quitting smoking. I want to be able to talk to you about. Okay. Do you have any other questions?
No, thank you so much.
Thank you.